Let us discuss about the shock as well as various types of shock. We have following types: hypovolemic, cardiogenic shock, septic as well as neurogenic. But for cardiovascular physiology, we are not going to discuss in detail about the neurogenic shock. So hypovolemic shock is the most common type of shock and most common clinical type of shock. And cardiogenic shock is the most common type of shock in MI. So for example, if you see the hypovolemic shock, during hypovolemic shock, there would be decrease in pulmonary capillary wedge pressure, there would be decrease in the cardiac output, and there would be a constriction of the peripheral vasculature. But if you see the cardiogenic shock, during cardiogenic shock, there will be an increase in the pulmonary capillary wedge pressure, there will be decrease in the cardiac output, and there will be constriction of the peripheral vasculature. But if you see the septic shock, there will be slight decrease in the pulmonary capillary wedge pressure, or it may be normal in the septic shock, and cardiac output also may be slightly increased or normal in the septic shock. And the peripheral vasculature undergoes vasodilation during septic shock. And this is about the shock as well as its physiological application. Next is atrial natriuretic peptide. Atrial natriuretic peptide is released from the atria in response to that of increased blood volume and increase in the right atrial pressure. So ANP causes vascular relaxation and constrict afferent arterioles and dilates afferent arterioles and promotes diuresis. This is known as aldosterone escape. Let us discuss few important high points about the vascular system of the heart. Coronary artery occlusion is most common in left anterior descending artery. Left atrium is located posteriorly and it is very close to that of esophagus. That's the reason whenever there is a left atrial enlargement, there will be compression of the esophagus and causes dysphagia. When left atrium is enlarged, there will be a dysphagia which is more commonly seen in mitral stenosis or left ventricular failure. And the pressure on the recurrent laryngeal nerve can lead to hoarseness of voice. This is what you need to know about high points, what we need to remember for cardiovascular physiology. Let us discuss important points about the blood loss and its effect on blood pressure, heart rate and respiratory rate. If the blood loss is less than 15%, there would be approximately no change in the blood pressure, but there would be a slight increase in the heart rate to maintain normal cardiac output and the minute volume, and respiratory rate is also normal. And if the blood loss is between 15 to 30%, again there would be no change in the blood pressure and heart rate will be increased and tachycardia can be seen, that is where the heart rate is approximately between 100 to 120 beats per minute, and respiratory rate also increases. So remember, in all the conditions of tachycardia, there would be tachypnea, increase in the respiratory rate. And if the blood loss is approximately between 30 to 40%, now there would be change in the blood pressure where the blood pressure is reduced and the heart rate is greater than 120 and weak. And respiratory rate is also greater than 120 and there would be symptomatic tachypnea. And if the blood loss is greater than 40% and there would be a marked decrease in the blood pressure, heart rate would be greater than 120 and 140 and respiratory rate is approximately between 20 to 30. So this is what you will see the effect of blood loss on the blood pressure, heart rate as well as on the respiration.